Welcome, everyone, to today's session of Hot Topics in Nutrition, Ask the Dietitian, Sugar, Supplements, and Nutritional Management for Patients with Cancer, led by Lisa Gibbs. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to the nutrition team for this continued partnership. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat feature throughout the session. At the end of the session, your questions in the chat will be used to moderate a Q&A. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I will now pass the workshop over to Lisa.
Thanks, Rebecca. So yes, again, my name is Lisa Gibbs. I'm a dietitian here at the Milford Satellite for Dana-Farber, and I'm excited to talk to you today about oncology nutrition and some hot topics in oncology nutrition. I've been a dietitian for over 25 years, and for the past 10 years, I've been specializing in oncology. So let's get into our topics. So questions that I hope to answer today or review are centered around the area of vitamin supplementation, sugar, is sugar okay, and what is the best diet for cancer? So for sure, I found that there is never one size fits all. There's, no two people going through the same cancer treatment or with the same cancer diagnosis are going to be treated the same in terms of their nutrition program. So for sure, we try to tailor, your nutrition program to each person. And one thing that remains consistent, though, is that we always try to use food instead of supplements wherever possible. So let's first get into our first sort of hot topic that we're going to talk about today, and that's centered around supplements. Can supplements help? So it's often when a person starts cancer treatment or has a cancer diagnosis that they're going to wonder if there's any vitamin or supplement that they should add in or that they should be taking. I always start off with saying be careful with the internet. It can be your friend or your foe with what you're going to read centered around supplements and nutrition. We do know that food is where the science is, not with supplements. So let's dive into the question a little bit more. Can supplements help if you have cancer or if you're undergoing cancer treatment? So, unfortunately, to date, we do not have evidence to support the use of supplements in cancer. We do have evidence that food can reduce cancer risk, but we don't have evidence to date that supplements can. Food is always best. There are many helpful compounds that are found in vegetables and fruits, and especially plant-based foods, and those compounds work together to offer beneficial effect. So, again, unfortunately, thus far, we do not have evidence that there's a supplement that can help. So let's dive into this a little bit more. Antioxidants, a subgroup of the supplements. So antioxidants include vitamin C, vitamin E, selenium, beta carotene, and lipoic acid. Those are sort of the most common antioxidants that we'll talk about. Certainly with COVID, we saw a huge increase in people taking vitamin C in hopes of helping keep that away. So antioxidants offer protection against damage to tissue cells. So several large studies have not demonstrated a reduction in cancer risk from these antioxidant supplements. Some have even shown an increased risk. The best advice is to consume your antioxidants through foods rather than supplements. So there's a concern around taking antioxidants, especially during treatment. I can say that if a person is undergoing radiation treatment, there is a lot of controversy around supplement use of antioxidants. In general, we will tell you to hold antioxidant supplements during radiation. So it's always important to make sure that you're communicating and you're talking with your oncology team around the supplements that you're taking. So I'm going to take you through a few studies that just sort of highlight supplement use. So this first one here was called the SELECT study, and it looked at antioxidants. This one looked at selenium and vitamin E supplementation, and it was actually done in prostate cancer. This study showed no benefit to taking those supplements. And unfortunately, it actually showed that taking high dose of vitamin E may actually promote a small increase in prostate cancer. So here's something just simple like vitamin E, but it did show that taking the supplement pill form showed an increase in prostate cancer. Another well-known study called this CARROT study showed that nutritional supplementation with high dose beta carotene, again, we're talking pill form of beta carotene, increased lung cancer risk among smokers. We know that eating fruits and vegetables did not. So again, just another study showing that supplements posed a negative outcome rather than a positive outcome. Another more recent study, this one was done in 2019. This is looking at probiotic supplements, and this is actually in correlation with immunotherapy. So it showed that probiotics over the counter was linked to about a 70% lower chance of response to immunotherapy. Again, and then they noted that eating a high fiber diet was actually a positive effect with immunotherapy treatment. So again, just important to make sure if you're taking supplements that you're talking with your team and communicating so that we can review them and make sure that they're safe. So generally what we'll say about supplements is they should be considered if a person is eating poorly. So if we have someone who is just really having a hard time getting in food, poor appetite, not eating balanced nutrition for an extended period of time, we may recommend something like a multivitamin mineral to cover the bases. Supplements also may be recommended if a deficiency is found. Here's a study. This is shifting gears a little bit to looking at herbal medicine. So this was a study on 44 different herbal supplements, so including black cohosh, echinacea, St. John's wort. And this one found that it was about 70% of the supplements actually were mislabeled, and they contained a different botanical than what was actually listed on the label. One of them, even rather than having the actual herb in it, was actually listed as senna was actually what was in it. So supplements are not regulated, and that's another concern with supplements. You don't always know what you're getting from one bottle to the next. The other concern with herbs is that they can potentially interfere with the work of chemotherapy. And certainly we don't want to do anything that's going to potentially interfere with our treatment regimen. Again, generally during treatment, we will recommend that you hold these extra supplements. So then what is okay to take? There are some supplements that are common and usually required during treatment. So vitamin D is a very common vitamin that a person may be deficient in, and it's usually by a blood work that we know that you need extra vitamin D. Calcium, we see this often, females, depending on your treatment regimen, but sometimes you're going to need calcium. Vitamin B12, especially if you follow a vegan diet, you're going to need some extra vitamin B12. Iron is sometimes needed. Again, this is something that is identified by a deficiency in your blood work. During treatment, potassium and magnesium are sometimes supplemented. Those levels sometimes can be altered depending on your treatment regimen. And then again, sometimes just a standard multivitamin mineral is suggested. So these are kind of the common ones that generally are okay during treatment. Certainly, though, it would be identified by blood work being low. Okay, so sugar and cancer, our next sort of hot topic. And I will say that sugar and cancer truly is one of the most complicated hot topics in oncology and nutrition. Somehow the stuff in the white ball got a bad rap and caused a whole lot of controversy around our diet recommendations. So let's kind of break it down and talk about what we do know. So first of all cells in our body, including cancer cells, but all cells are going to use sugar from the bloodstream for fuel. Glucose, it comes, not all, quote, sugar is the same. Glucose comes from foods that contain carbohydrates. So we have your refined carbohydrate foods, sugar and refined foods, and then we have those healthful carbohydrates, fruits, vegetables, whole grains, and glucose is derived from them. To date, we have no randomized control trial showing that sugar causes cancer. But what we have found is that there is an indirect link between sugar and cancer. And so let's talk a little bit more about what we know. So in a person whose diet is, has excess sugar, has a lot of refined foods. So we're talking someone who's drinking soda and having donuts and cookies and sweets day to day, every day, in excessive amounts. That's going to lead to weight gain and obesity. And that weight gain and obesity, it's linked with inflammation. So we know that a lot of sugar over time, in combination with decreased activity, not eating healthy foods like fruits and vegetables, puts your body in this state of inflammation. And what we know is it's this inflammation is sort of a favorable setting for cancer growth. We know that cancer incidence tracks closely with increases in body weight and obesity. So it's sort of this link with obesity and inflammation where we see a correlation with sugar and cancer. But it's not as simple as eating a piece of cake causes cancer. So the American Institute for Cancer Research, the AICR, we're going to talk a little bit more about this organization, but they show that being overweight or obese can increase the risk of up to 12 different types of cancers. So, most people know about sugar and diabetes and sugar and heart disease, but now we're also sort of seeing this link with sugar and obesity and cancer as well. I bring up this study just because it's a study that sort of looks at and shows the benefit of a low-fat diet. I feel like, more of a trend is that people sort of have this low carb, low sugar, low, focus on carbohydrate foods. Well, this is a study that showed a benefit of a low fat diet. So it looked at fat reduction, and this was in breast cancer. It was about 2,400 women, It's called the WINS study. And the low-fat diet group consumed 20% of calories from fat. So again, just a low-fat diet. And what they found was that the relapse-free survival was 24%, almost 25% higher in the low-fat group. So those following the low-fat diet had relapse-free survival, so higher relapse-free survival. So again, beneficial thing following a low-fat diet. So as I mentioned, the AICR, the American Institute for Cancer Research. This is an organization that is wonderful. They provide that word evidence-based recommendations. You know, in oncology nutrition, we really want to look at what we know is that word evidence-based, truly studied. So they look at thousands of studies, they continuously update their recommendations. So they have recommendations centered around both cancer prevention and survivorship. So if you are going to go online and sort of want some reputable information, this would be a wonderful website to go to, the AICR. And so this next slide, I think, is going to be, I'm not sure if you can read the print, but these are our recommendations from the AICR that are evidence-based for cancer prevention. And they also align perfectly with survivorship recommendations as well. So I'm going to read over these 10 recommendations. If you want more information on them, I do encourage you to go to the website. It's aicr.org to check out more extensive information about them. So the first recommendation is to be at a healthy weight. Again, just trying to minimize, excessive weight gain throughout your adult life. So aiming to be at a healthy weight. The number 2 is let's try to be physically active. We know that being physically active and exercising, so many benefits for so many great reasons in terms of cancer risk reduction and also survivorship. Number 3, eat a diet that's rich in whole grains, vegetables, fruits, and beans. We know that fiber is a really beneficial thing. Fruits, vegetables, plant-based eating, we're going to talk a little bit more about that in a few slides. So really trying to load your diet. We used to say 5 a day. I usually try to encourage 8 to 10 servings a day of fruits, vegetables, whole grains throughout the day. Number 4, limit consumption of, quote, fast foods and other processed foods that are high in fat, starches, and sugars. General good recommendation. Number 5, limit consumption of red meat and processed meat. And interestingly, the guideline has shifted a little bit over the years, and now it says eat little, if any, processed meat. So processed meat is your packaged meats. So your bacon, bologna, salami, hot dogs, packaged meats that if you put them in your fridge, they're going to last, for 6 months or so. We know that those aren't all that natural. Red meat, we say no more than 12 to 18 ounces per week. So that's your beef, your pork, and your lamb. It does include pork in that guideline. The next recommendation is to limit consumption of sugar-sweetened drinks. And, we bring this up because there's strong evidence that regularly drinking sugar-sweetened drinks, it's a link to weight gain. Again, liquid calories really can add up. And we know that we mentioned before that the weight gain and greater body mass index is that link to at least 12 different cancers. So cutting out on the sugar-sweetened drinks, coffee drinks, soda, energy drinks, alcohol calories, that's a really good goal that you can make to help decrease your cancer risk and your survivorship. So the next one is limit alcohol to reduce cancer risk. I think that one speaks for its own. Most people know to decrease alcohol intake. The next one speaks to our hot topic around supplements. Do not use supplements for cancer prevention. I wish there was a vitamin or an herbal that I could tell everyone to take that's going to help decrease cancer prevention. We just don't have that evidence right now. And as I sort of noted, sometimes taking supplements can do more harm than good. The evidence is around eating fruits, vegetables, plant-based eating. The number 9 is centered around breastfeeding. For mothers, breastfeed your baby if you can. And then our last highlighted recommendation here is after a cancer diagnosis, follow the recommendations because they are going to be perfectly aligned with cancer survivorship. Okay. So those are the 10 evidence-based recommendations. I really feel if you're following those recommendations, they align nicely with many of our chronic diseases, diabetes, heart disease, even just your overall wellness. And now we know cancer too. So the next thing I want to shift to is talking about, well, what diets are okay to follow? What are reputable diets? If you're going to sort of want to follow a diet program, which ones are okay to follow? So these are 4 diets that all of them sort of have a lot of similarities, and they are good to follow. So plant-based diet, the DASH diet, the Mediterranean diet, and then the balanced plates. So let's dive into these a little bit. First of all, plant-based. So what does plant-based mean? Plant-based doesn't necessarily mean that you have to be a vegetarian or vegan. It doesn't mean that. It just means that you eat fruits and vegetables throughout the day. I think there's a lot of people out there that if we do food records and food recalls, they might be only eating 1 or 2 fruits or vegetables throughout the day. And, cancer protection is in our colorful fruits and vegetables. So really trying to boost up that number, starting right off first thing in the morning, having berries in your cereal, berries in your yogurt, spinach in your eggs, really sort of working in those fruits and vegetables wherever you can. So plant-based just means more fruits, vegetables, whole grains, legumes, nuts, and seeds. The fiber is super beneficial. We know that's going to help generate healthy gut bacteria and be really great for your digestive system. It's all centered around phytonutrients. And so phyto means plant. And these are the things that are naturally occurring in plants that offer a lot of protection and benefit. So it's the color, the more pungent, the more variety of color that you're getting from plants throughout the day in your diet, the more protection you're going to have. So I say bring on the rainbow when you're eating throughout the day, reds, greens, orange, yellows. Again, that's where our real protection is. So eat your fruits and your vegetables. People will often ask about what a serving size is. I just kind of wanted to add this in here. Serving size, 1 cup of raw leafy vegetables or berries, a cup of cooked vegetables, a medium-sized piece of fruit, and I think that's where you just have to use your good, common sense. If it's a really big piece of fruit, that you're going to want to cut it in half or maybe even a third. A 1/4 cup of dried fruit, and then 3/4 a cup of 100% juice for your juice group. So I'm going to go back to our diets. We talked plant-based, the DASH diet. I just want to touch on DASH and these 3 other diets. The DASH diet, dietary approaches to stop hypertension. It's actually an evidence-based diet plan to help with blood pressure management. So if you're a person who has high blood pressure, this would be a really great diet to look up and to follow. It's rich in vegetables, fruits, whole grains. It includes low fat or fat-free dairy products, fish, poultry, beans, and nuts. So this diet is rich in potassium and magnesium and low in sodium. So the main thing here is that we're also emphasizing that it's low in sodium to help with blood pressure management. So that's a reputable, great diet to follow. The other one is the Mediterranean diet. The Mediterranean diet, it typically includes, again, lots of fruits, vegetables, healthy grains, potatoes, nuts, seeds, and beans. Olive oil is, the primary fat source, and there's very low amounts of dairy, eggs, and its main protein source is fish and poultry. The only thing about the Mediterranean diet is that it does include red wine or wine, and that would be one thing that we would sort of want to cut back on or omit with the Mediterranean diet. The other diet is the balanced plate, and this is just a wonderful, simple teaching tool that's out there. If you think about your plate, you want to have half your plate be vegetables and fruits, a fourth of it be your protein, and a fourth of it be your nice whole grain. Or you can say a third, a third, a third, where a third is your protein, a third is your vegetable, and a third is your nice whole grain. So it's just thinking about combination foods. Like, let's not just eat a plate of chicken, let's have your vegetables and your whole grains too. Foods work well together, synergy, again, complementing your protein with a whole grain and a vegetable. Your body really does well with that. So this is just sort of my summary. We want people to stop eating like this and more like this, more of the nice healthy protein, lots of vegetables and whole grains. So lastly, I do want to touch on, what if you don't feel well? What if you're during treatment and you're having some side effects from treatment and you're not feeling well? It is completely okay to liberalize your diet. Maybe during treatment, you're not going to be able to eat all these fruits and vegetables and whole grains, and you're going to need foods that are easy to digest. This is where I encourage you to aim to talk with a dietitian, meet with your dietitian, to get your individualized meal plan. A personalized meal plan really can help you tremendously throughout your cancer journey. I will say, back to if you're not feeling well, some of the most consistent messages, though, are eating scheduled meals and snacks, eating by the clock so that you avoid you being empty, and sticking with easy to digest foods. So this concludes our lecture today. Again, I encourage you to aim to talk with your dietitian for your individualized meal plan. And I hope that you all are well. Thanks, everyone.
Great. Thank you so much, Lisa. That was a great presentation. I just had one real quick question. So I know
Sure.
that you are based in Milford, but in general, for any site, how can a patient get in touch with a nutritionist?
Absolutely. I would just talk with the team, whether it's the doctor or the nurse, and they can put in a referral for the dietitian.
Perfect.
Yeah.
Thank you so much.
And I will
And
say
like,
that
yes,
I just want to add in, we really do try to make it as convenient for the person as possible. So most of the satellites will, or in the centers, will offer phone consults, virtual consults, or will aim to meet in person during treatment. So we really do try to work around schedule.
great. Thank you so much. It sounds very accommodating. So please, everybody, reach out to a nutritionist or dietitian. And thank you again, Lisa. Like I
You're welcome.
said earlier, this will be posted on our Blum YouTube playlist as well as our Blum Digital Resource Center. Have a great day.
Thank you.